Yeah, so I've been a nurse for over 30 years, and I've been here at the hospital for 10 years now. Prior to that, I have a storied history of starting out as an emergency room nurse and flight nurse before I went into leadership. About 6 months out of school, so I've been in leadership all that time. Here, I'm the Vice President of Patient Care Services, Chief Nurse Executive, and also hold the additional title of Chief Academic Officer. So the local healthcare district, which is Sierra View Local Healthcare District, is the governance healthcare district for the Porterville and greater area. We have a very diverse population of patients that go way up into the mountains of the Sierra Nevadas, out to the west towards the coast, to the south, Bakersfield, and to the north, Visalia. And sometimes it can take over an hour, hour and a half for an even ambulance to get to us if they're coming from a remote area. So our responsibility for about 115,000 lives is to be the hospital that they can come to and make sure they get emergent care, surgical care, obstetrical care, pediatric care. If we can't handle the level of care they need here, our job is to stabilize that patient and get them to a higher level of care. Yeah, here at Sierra View Medical Center, we're sort of isolated away. Although we're not a rural designated area, we often are thought of as a rural area of the Central Valley. And so it's hard to recruit sometimes when you have lovely areas like the Bay and Southern California competing against the Central Valley. And so it's been very difficult to recruit nurses and sometimes retain some of our younger nurses who have a vision maybe to go to bigger medical centers or more desirable perhaps locations in the state or outside the state. So oftentimes we've had to grow our own. And what do I mean by that? That we would take a postpartum nurse and introduce them to labor and delivery and as a new model for them and as a new practice area. Or taking a med-surg nurse and introducing them to emergency nursing. We do that a lot here, but at some point, that is not the effective way to continue to recruit when you have so many vacancies. So sometimes you've got to look outside the paradigm that you have for a new answer. Yeah, so Dr. Yusuf and I started to talk about School in the Box. It's not even called School in the Box, but as a concept back in 2019. And it evolved over time. And as we began to refine what it could possibly look like for a partnership, perhaps, between Unitek and Sierra View Medical Center, how that would benefit our organizations, both of us, to be able to introduce nurses that we are somehow missing and cannot recruit in some of the ways that I talked about previously. How do we have our own perhaps school of nursing attached to the hospital that would be able to reinforce the need for nurses in our geographic area, where traditionally we're educating nurses in our own valley that may not be from the valley, and they go back to wherever they came from, leaving us after a year of training with no nurse to fill the spot. We wanted to break that paradigm. And so it was really important in the discussion of School in a Box as we developed the concept that we really wanted to retain those nurses. Yeah, conceptually, from School in the Box, we had to figure out also the back end of what it'd be like for the students, let alone how the hospital and Unitek would work together. But as we think about that model for the students and we get through the first year of online asynchronous learning, now comes the really hard part, nursing school, and being able to balance work along with simulation lab, clinicals, and doing their education. And so we have worked very hard initially with the students as we introduce them to this concept of being a student, that we're here to support them, that their leaders are going to help support them with their schedules while they're going to school, that there's an opportunity, if it gets too overwhelming, they can go per diem and work as they need to. Our main focus is for them all to graduate. And so from our commitment on the hospital side is to do that. In the partnership with Unitek, it's about making sure that when a student has a barrier to learning or something comes up, a life crisis, that we work jointly together to make sure we support the student through whatever it is to keep them engaged and moving forward in the program. I'm happy to say we had an opportunity this first year where we had a student who was having some barriers to get through the program and didn't quite know how to raise their hand and say, I need help. So between the hospital and the school, we supported the student jointly, and that student is having no more problems. So Again, it's a power of the partnership with Unitek and Sierra View, I think, that is really supporting the students well. Yeah, I think there's a couple things that come from this. First of all, sometimes our collegiate system in the state of California is hard to get into nursing school. It's very competitive, and I alluded a little earlier in some questions that I addressed that it can be difficult for sometimes Central Valley prospective students to get accepted into nursing programs when there's high competition from the south of the state and the Bay Area. This kind of levels the playing field, and it gives our local prospective students an opportunity to get into a program that they may not have been able to or might have taken several years to get into. So with that, a blended cohort gives us the opportunity too for our community to be invested in a nursing program that's sponsored by the hospital and powered by Unitek, so that they have an opportunity to work in their hometown hospital or even in the region. I think probably the one thing that keeps chief nurses awake at night across the country is our staffing. You know, as an outcome of the pandemic, we've lost our outward migration of nurses. Either they've retired, they've decided to do something different, or they've gone somewhere else to practice, leaving pretty substantive voids. So with that, this gives us the opportunity, as you talked about, out of these three cohorts, when they graduate in 2026 and 2027, and I'll remind the audience it's 2024, very beginning, that we still have a gap to get filled before they even come out of school. We are hoping that enough of those nurses from all the programs will be invested to stay in our communities and fill a large void that we have of vacancies. So that is our premise, and that is our guiding principle, I would say.